Now, the Free State Premier Sisi Ntombela and members of the Provincial Command Council have outlined the latest COVID-19 developments today. Our reporter Makgala Masiteng is standing by with the Premier. Let's go live to them. A very good morning to you. What's the latest in the Free State?
Thank you very much, Desiree. Yes, as you have just outlined, yes, indeed, the Premier and the Provincial Command Council have just briefed the media in terms of where the province is in terms of fighting coronavirus in the province. And she has just identified, or rather said that Bloemfontein remains the epicenter in the Free State. And they were also outlining in terms of where are we in terms of moving to level 3. And we have the Premier of the Free State right now with us, who will tell us more about where the province is currently. The Premier, thank you very much for joining us. I want you to dwell into the issue of why are you saying that Bloemfontein is not ready to move to level 3 while other towns are?
Hey, Makgala, I'm still very worried about Bloemfontein. You have heard yourself, I've said it's almost, we are having 165 cases in the Free State, and out of 165, 141 cases are from Bloemfontein. So it shows you that for Bloemfontein, it is still not safe. So that's why we are saying we are really not prepared to move to level 4 at Bloemfontein. I think we must remain to level 4 in Free State. And we must remember this is winter time and this virus is increasing now. So really, definitely, we must remain in level 4 in Bloemfontein.
So does that mean, is it possible to control the issue of having Bloemfontein at level 4 while other towns are at level 3?
Makgala, as long as our people can just listen, that they must not visit Bloemfontein, they must not come to Bloemfontein if it's not necessary, we will be able to control it. They must just stay where they are until we are sure that everybody is tested in Bloemfontein, until we are sure everybody is screened in Bloemfontein. Stay away from Bloemfontein. We will win this war.
Well, we also have the MEC of Health in the Free State, Mayor Montsentiu, who will get into details in terms of how are we moving in terms of fighting coronavirus in the Free State. MEC, thank you very much for also joining us today. I've just spoken to the Premier, especially in terms of leaving Bloemfontein at level 4 while other towns will move to level 3 rather. Tell us, how are we in terms of fighting the coronavirus in the Free State?
Like I say, we are evidence-based. Once we get a case that tests positive, we immediately trace the contacts, and we move with speed to trace the contacts of each patient that tests positive within the province. That is something that we have done very well and we've mastered, and it helped us contain the spread of the virus. Because once you get you, then we make sure that we quarantine that person, and we quarantine the contacts of the index person that would have tested positive, and make sure that even the person that tested positive, it's either you are taken out to go and be quarantined somewhere, so that we monitor you, how do you do until the 14 days are over, and then you can be released back to your own life. But we make sure that we test every contact, we trace every contact thoroughly, and make sure that those contacts, even if they are asymptomatic, even if they've tested negative, we make sure that we quarantine them for the period of 14 days.
We talk about Bloemfontein as the epicenter of the Free State. Are we still having more cases coming from this province?
Yes, we are finding more cases in Bloemfontein. We have done a lot of mass screening in our township, but then the cases that we are finding recently are cases that would be in the admission in the hospitals, who would then develop upper respiratory tract infection as signs and symptoms, and then they would be tested and they test positive. Most of the new cases from last week and this week are the cases that we found in the hospital. That is why we're saying our strategy now would move. While we are not going to leave completely the testing and screening at the township, but would target the hospitals now. Let's go to the people that are in the facilities and make sure that we get those that develop the respiratory tract infection, upper respiratory tract infection, and do the swabbing on them, and also swab especially the vulnerable, the cardiovascular patients, the diabetic patient, and hypertension patients. Make sure that we swab them, because those are the vulnerable cases that can develop COVID-19. Yeah.
How far are we in terms of screening and testing in the province?
We have screened more than we are close to 1.4 million. In fact, it's 1.3 million that has been tested. And as for the testing, it's 19,000 that have been tested already in the province.
MEC, we also want to get into details in terms of how are we doing as we are moving to level 3. You have also mentioned during the media briefing that we have welcomed doctors from Cuba.
We have welcomed doctors from Cuba. Most of them are family physicians, and they will be assisting us. We also have epidemiologists that will also assist us in the tests right there where we are working in the communities where we find these cases. They are going to be divided according to the district, our 5 districts of the Free State, so that they assist us in case management of all the people that would have tested positive in all the districts. The epidemiologist would also help us how to manage these cases. And why are we saying we're not going to take the ball away from Bloemfontein? Bloemfontein has given us the highest number of cases that are in Free State, and it remains the epicenter, and it's still the new cases, most of them come from Bloemfontein. That says Bloemfontein, there's still danger. We said we may be having this virus still moving, uncontrollable in Bloemfontein, unseen. So we need to make sure that we dig deep in trying to find the cases in this town in Bloemfontein.
But now the issue is people coming from Thaba Nchu and Botshabelo will be at level 3 and will be coming into Bloemfontein to work and for different reasons. How will we control that?
That will have to, the Provincial Command Center will have to sit and see how they work around that. We do have people that have tested positive in Botshabelo 1, Thaba Nchu we've still got 0, but then we'll have to work around that. That may be the people that are staying in Thaba Nchu for some time now. We should make them lock them out of Bloemfontein. Even if I believe if we can take about 2 weeks working very hard in Bloemfontein and also using the extra pair of hands that we've got from Cuba, we can deal with the problem of Bloemfontein. It's not that bad that we can't manage. It's something that we can manage as the province.
Thank you very much. That is the MEC of Health in the Free State, Montentiu, outlining in terms of how the province is into fighting coronavirus. And she has also outlined how this will be controlled, as they said that Bloemfontein cannot, or rather is not ready to move to level 3, while other towns will be able to leave to level 3, while Bloemfontein rather remains at level 4. So that's how things will be going in the Free State, as the Bloemfontein remains the epicenter of all cases in the province. Desiree?
Makgala Masiteng, thank you so much for that update. Of course, she earlier also